Minister, people waking up this morning hearing that we're possibly in level 5 lockdown until May, is that going to be the case?
Good morning, Ciara. Good morning, Shane. What I might do, Ciara, if it's helpful for your listeners, is just read out one or two lines from Dr. Glynn's letter to me last night, just because we are following NPHET's advice. So just so people know exactly what it is. Would that be helpful?
Yeah, in brief though.
Yeah, very briefly. So I just pulled out a few lines here for the chat this morning. So on the disease itself, it says, in summary, Ireland continues to experience a very concerning and precarious epidemiological situation. Incidence is falling, but the rate of decline has slowed and daily counts remain very high. And then when he comes into the advice, here's the most important bit. It says, NPHET therefore advises that current restrictions should be extended, subject to continued improvement in the profile of the disease to the end of February. There should, however, be scope to facilitate the safe return of in-school education and childcare services, but this must be on a cautious and phased basis. And then to Shane's question there around timing, it says, NPHET further notes that it is too early to advise on how and when other restrictions should be eased given current uncertainties. And really the two big uncertainties that they're talking about, Ciara, are this horrible UK variant, and we have more information on that. And on the other side, on the bright side, on the vaccines, there are more and more vaccines coming online.
Okay. And we'll get to all of that variance and everything. But first of all, you mentioned the schools. So NPHET has said it's okay to reintroduce the schools opening in a face-to-face way on a phased basis. And people are saying, well, the start of March, that's great. But it is a phased basis. And towards the end of March, the Easter holidays start. So a huge number of children will likely not, in fact, go back to school till mid-April. Is that correct?
So it's too early to say at this point. I know Minister Foley has been working night and day with the education partners on this phased reopening. My understanding is what the government is working towards and what Minister Foley is working towards is from the start of March, Leaving Cert in junior and senior infants, and then a steady reopening. But as always, we will be in very close contact with the public health teams to see how is this disease evolving through March, and that will inform the phased reopening.
Okay. Other things that people have texted the show about, Minister, and are, I suppose, upset about or curious about, are things that don't seem to be particularly high risk that will nonetheless still not be allowed. Things like outdoor sports, you know, our under 11s going to training outdoors as a group. That seems unfortunate. There's been a kind of a cold water poured over the idea that we might be able to meet up outdoors with friends. We might be able to have a coffee outdoors or those types of things. Construction, like we're not really hearing anything concrete about when that might come back. These things all seem to be relatively low risk. Are you saying that the variants are such that we can't engage in any kind of congregated setting, irrespective indoor, outdoor or any other way?
No, I don't think that's what it's saying. And, you know, everything is not being taken off the table. But I think it's important to look at what has happened when we've come out of more severe restrictions in the past. So what tends to happen is people very reasonably say, well, can we open, construction or essential construction because, in fairness, the industry has done very well. And other people say, well, can we play golf? Because that's safe. And other people say, well, can we get sports going for children because it is important, and God knows it is really important. And each of them on their own probably wouldn't make much of a difference at all. The concern is that when you start doing lots of reasonable things together, you begin to have an impact. So, for example, NPHET's real concern about education is not actually what happens inside the schools. It's the mass movement of people to and from the schools. And of course, the big wild card we're dealing with, what's different this time, is this variant. So as Dr. Glynn said at the briefing last night, nearly all of the new cases now are the UK variant. So it's around 90%. Mm-hmm. We know that the UK variant is much more contagious. And unfortunately, what we are also finding out now, based on research from the UK, which is relatively new information, is it looks like the UK variant is also more severe, both in terms of hospitalisation and fatality.
Okay, and indeed, Paul Reid was saying something very similar to us here on the programme last week.